So you'll place the child in supine, head and midline, and you're going to stroke from the lips to the cheek. A normal response would be no reaction. Abnormal response would be turning the head towards the side that is touched. Child is supine with head and midline and the legs are extended. You hold one leg in extension at the knee and apply firm pressure to the sole of that foot. Normal is no reaction, and abnormal would be flexion of the opposite leg at the knee and then extension. Child is supine with head and midline. The legs are extended. Apply a noxious stimulus to the sole of the foot. Normal is no reaction. Abnormal is withdrawing the same leg. Support infant in vertical position and allow feet to make firm contact with the table. Normal, the infant should be able to support some of its body weight. Abnormal, the infant's unable to stand at all. Support infant in vertical position, have the feet touch the surface and incline the infant forward. Normal would be no reaction. Abnormal would be a stepping motion.
Infant is supine and gently turn the infant's head to one side. A normal response would be extension of the ipsilateral limbs and a flexion of the contralateral limbs. An abnormal response would be no reaction. Evaluate the baby in prone. You should see more flexor tone. Evaluate the baby in supine. You should see more extensor tone. Put the baby in quadruped. Passively flex the head forward. A normal response would be head flexion causes upper extremity flexion and lower extremity extension. Then extend the head backwards. Normal response should be upper extremity extension and lower extremity flexion. Abnormal response would be no reaction. Place the baby prone or supine with chest or shoulder touching the support surface. The normal response would be the head would pull up to the upright position. Abnormal response would be no reaction.
You want to do the neck?
Mm-hmm. Put the baby in supine with head in midline. Turn the infant's head to one side. There might be a segmented roll as a normal response, but the whole body rolling as a unit would be an abnormal response. Place the infant in supine, head in midline, and flex one arm over the chest and rotate the limb across the body. The normal response would be no reaction. An abnormal response would be the upper trunk rotates to the same side.
Support the infant in the air prone. Normal reaction, the head, back, and hips will all extend. Abnormal would be no response.
Starting with downward.
We're going to tilt the kid in all different directions. Normal response would be protective extension downward and protective extension leaning forward. There would be no protective extension in side tilting or backwards tilting. Abnormal would be no response in any direction. So you tilt the child in prone, supine, sitting, quadruped, and standing. Normal reaction is going to be in prone. You'll have elongation of the weight-bearing side with flexion of the contralateral side. In supine, a 6-month-old will have no reaction to the tilt. In sitting, a 6-month-old will have no reaction to the tilt. In quadruped, they will have no reaction to the tilt. And in standing, the child will have no reaction to the tilt. Okay. Child supine, head and midline. You support the head at an angle about halfway between supine and sitting and drop the neck. Normal would be abduction of the shoulder and the extension of the elbows, wrists, and fingers. Abnormal would be no response.
Wee!